I'm Rachel. I'm going to be your student nurse for the day. And today I'm just going to be doing a clean dressing change for you. I'm going to start by determining the size and the location of your wound. From what I can tell, you have a medium-sized wound and it is located on the abdomen, so it's an abdominal wound. I'm also going to check my physician's orders for the make sure I have permission to do the abdominal change. Also, if my patient were to be experiencing any pain, I would provide the patient with the pain medication 30 to 40 minutes prior to the dressing change. Okay, so now I'm going to make sure I have all of my necessary products for this. I have, I have my polylinen drape, my dry gauze, my 4x4 gauze, my abdominal pad, or my ABD pad, my forceps, I have my saline, my cotton tips applicators, my tape, my biohazard bag, my sterile gloves, and normally I would also have regular gloves, but in the case right now, I do not, just because of the circumstances. So I will just be pretending like I'm putting on regular gloves. Okay, so now I'm going to sanitize before I enter the patient's room. And I'm going to put on a pair of regular gloves. Okay. Hi, I'm Rachel. I'm going to be your student nurse for the day. Can you go ahead and verify your name and date of birth for me, please? Okay, thank you. And I'm going to check that on her wristband just to make sure it was right, accurate. Okay, also, can you verify any of your allergies for me, please? Okay, thank you. Okay, so I am just going to explain this procedure to you. I will be taking off your old dressing, cleaning up your wound, assessing it, and applying a new clean dressing change to the wound. I'm going to start by putting the biohazard bag open and cuffing it so that I have it ready. And I'm also going to raise you up to waist height. Okay, awesome. So now I'm going to take off your old dressing, but first I'm going to provide hand hygiene with my hand sanitizer. Okay, and I'm going to put on a new pair of gloves. This was after I discarded my old gloves, by the way. Put on my new pair of gloves. Okay, so I'm going to start by holding down your skin and lifting the old tape as I'm stabilizing your skin. Okay, and now I'm going to lift the abdominal pad with the gauze away from the patient's head, which is right here, so they can't see it. I'm going to assess the wound. It is red, moist, there's no signs of drainage, there's no abrasions or anything, so no signs of infection. It looks great. I'm also going to count how many gauze I have. 1, 2, 3, 4. Okay, so I have 4 gauze, so I'm going to note that. And then I'm going to discard all of this into the biohazard bag. Okay, and then I'm going to I would discard the abdominal pad, but for this purpose, I only have one. So I'm going to pretend like I put the old one in there, and I'm going to reuse this one for when I do the clean dressing change. Okay, and now I'm going to discard those gloves, put them in the biohazard bag, and I'm going to reapply hand sanitizer. Okay, and then now I'm going to put on another pair of regular gloves. I'm going to move this out of the way while I prepare my polylinen drape. I'm just going to lay it out and get all of the tools that I need to get ready to clean and apply the new dressing. So first I have my polylinen drape. Okay. And I can touch the blue part of this and also the outer 1 inch. And I'm going to stand to the side so that I have no signs of contamination. I'm going to grab the outer 1 inch and lay it on the table. Okay, so there was no signs of contamination because I did not cross over the drape, and I only touched the blue outer edge and the white outer inch. Okay, so now I'm going to put the things that I need on top of it. So I'm going to start with my dry gauze. I'm going to make sure I do not cross the drape in order to cross-contaminate and get any germs or contamination on the drape. I also will need my ABD pad. I'm going to pretend like I'm opening it and apply that on there. Discard the biohazard bag. Okay, I also have my forceps. Okay. And the last thing I'm going to put on the polylinen drape would be my cotton tips applicators. So I'm going to open those real quick. Okay, and I'm going to toss those on there. And then again, for all of those, I made sure that I did not cross the or hover over the drape in order to contaminate it. But for now, I am going to discard those old gloves, put them in the biohazard bag, and I'm going to re-sanitize. Okay, so I still have my 4x4 sponges, which I'm going to bring over to the patient's side. Okay, and I'm going to lift the top of this and put it in the back so that it's easier for me to access the gauze. Okay, I'm going to make sure I walk around the linen so I do not touch it. And I also have my tape right here and my saline and my sterile gloves. I'm going to apply some of my saline to the 4x4 gauze. Okay. All right, so now that I've done that, I am going to reapply my hand sanitizer. I'm going to discard my old gloves, put them in the biohazard bag, reapply hand sanitizer. Okay, so now I'm going to be putting on my sterile gloves. So I am going to open this package very carefully, making sure not to touch the sterile gloves at all. Okay, and I'm going to start by putting on the glove for my dominant hand. So I'm going to grab the piece of the glove that goes on the inside towards next to my skin. Okay, so I'm going to grab it like this, and then I am going to carefully place my hand in the glove, making sure I do not touch any of the sterile part with my skin. It's kind of hard to get in. Okay, and so I'm going to pull it down with my finger, still on the side that is not sterile. Okay, so now I'm going to grab the other glove, and this time I can touch any part of this glove because this hand is already sterile. And so I'm going to help put this glove on without touching the skin with my sterile glove. Okay, and again, I'm going to pull this down so I do not get any contamination. Okay, so I'm going to move that out of the way. All right, so first I'm going to start by cleaning the wound. So I'm going to use my forceps, making sure not to go over the linen too much. And I'm going to grab a piece of the 4x4 gauze and I'm going to wring it out as much as it needs. And I'm going to start in the middle of the wound and clean from the top to the bottom. And then I'll be discarding this into the biohazard bag. Okay, so now I'm going to grab another gauze, 4x4, wring it out, and clean on the right edge of the outer edge of the wound and discard this into the biohazard. And lastly, for cleaning, I'm going to grab another 4x4 gauze and I'm going to wring this one out as necessary also. Okay, and I'm going to apply it to the other edge of the wound. I'm going to discard this, and I also can discard the forceps as well because I no longer need them. So I put those in the biohazard bag as well. Next, I'm going to grab the, well first I'm going to grab a cotton tipped applicator because I'll need it when applying my moist 4x4 into the dressing. So I'm going to gently grab my cotton tipped applicator, and next I'm going to grab my gauze and I'm going to wring it out. And using my sterile fingers, I'm just going to pull this apart to its thinnest layer. Okay. And so I'm going to do this, and then I will fold it appropriately, and I will turn it like this. Okay, so now I'm going to use my cotton tipped applicator, and well, I'm no longer using that one because it fell, so I'm going to grab my second cotton tipped applicator. Okay, and I'm going to use this to gently put in the wet gauze, the saline gauze, making sure I cover every part of the wound. I can also use my fingers to help if needed. Okay, I'm going to discard this into the biohazard bag. Alright, so now that I have applied the sterilized saline gauze into the wound, it is covering all parts of the wound, there's none shown. I am now able to apply the dry gauze and lay them on top of this wound. So I'm going to grab one dry gauze and put it right here. And now I'm going to grab the other dry gauze and place it next to that one. Okay, so the last step is we're going to put the ABD pad on top of the wound. So I'm going to grab my ABD pad and I'm going to place it on top of the wound with the blue line side up, because that is the part that is not sterile. And so now I am going to grab my tape and I'm going to rip off 3 evenly sized pieces to get the wound to stick to, or to get the abdominal pad to stick to the wound. Okay, 1 piece. And then through all this, I'm still making sure I do not cross over my linen just to contaminate it still. Okay, I'm applying my second piece of tape. And then part of my glove did just touch the table. It's also a clean, flat surface that I'm applying this on. It has to be dry, clean, and flat. So you do have to make sure that before you prepare any of these things that you are doing it on a clean, dry, flat surface. So just to say that, but part of my glove did just touch the table, so I'm gonna make sure that I do not use anything with that pinky anymore. And I'm just going to use the parts of my glove that are still sterile. And I'm applying the 3rd piece of tape. Okay, so now that I am done, I've finished applying the tape and I've finished cleaning the wound, so now I'm able to discard. Also, when I was doing this, the wound was red, it was still moist. There was no signs of infection or drainage of any sort, no abrasion, so that was great. That was why I went ahead and applied this stuff. But now that I'm finished, I can go ahead and discard. Well, actually, I'm going to throw away all of the things that I use into the biohazard bag. Okay. And I can also discard my gloves that I used. And lastly, I'm going to apply hand sanitizer now that I'm finished with everything to provide hand hygiene. Okay, and so now that it's done, I will be documenting that I had done the wound, documenting that the physician's orders were there. I would document that it was red and moist and there was no signs of infection or drainage. I would also make sure to include the patient's response to the dressing change and how they reacted to it. And then for the tape, I would also put my initials, the time and the date on there so that anyone was able to access it to know when the last dressing change is. But other than that, I will document all of the above things and when it was done. And that is how you do a damp to damp clean dressing change.